Vital sign. The four main vital signs: temperature, pulse rate, respiration rate, and blood pressure.
Good day, student nursing assistants. So for today's video, we will demonstrating how to assess vital signs. So first step you have to do is identify the patient, discuss their procedure, and assess the patient ability. To assist the procedure, this is promote active participation of the patient during the procedure. Second, prepare all the equipment needed and ensure they're in all good condition. This facilitate organized assessment and measurement. Third, provide privacy in this necessary to build trust between patient and healthcare provider. Lastly, perform the medical hand washing. First is wet hands with water, then apply hand soap and rub hands palm to palm, then left palm over right dorsum with interlaced fingers and vice versa, and back of fingers of opposite palm with fingers interlock. Rotational rubbing with fingers of the right hand, then rotational rubbing with fingers of the left hand. And lastly, rinse hand with water, and then dry hand with clean towel or tissue and dispose it. Getting body temperature help the patient to assume a position of comfort. Auxiliary temperature, this is to promote relaxation. Take thermometer and turn on thermometer and place it into the armpit. Placing the device in contact while auxiliary blood supply. Can maintain a device in proper position. Remove the thermometer and read into the digital display. This is allow inaccurate temperature reading. Inform your patient his or her body temperature. Clean the temperature using the alcohol swab before placing it back. This is prevent the transmission of pathogens, microorganisms. Place the thermometer back to the holder and keep it securely until next to use. In taking the pulse, position the patient arms relaxed and supported. Place fingertips, index and middle finger in the inner surface of the wrist. Fingertips are sensitive, facilitating pulse patient times. Compress alternately gently so it can be felt distinctly. These stabilize wrist and allow pressure to be inserted. Using a watch, begin counting the pulse when the clock's second hand on the 12. Count your pulse for 60 seconds or for 15 seconds and then multiply by 4 to calculate beats per minute. The respiration keeps fingertips placed after counting the pulse to know the patient respiration. Make sure do not know you're counting respiration to avoid controlled breathing. Count the number of respiration for 1 full minute. Lastly, inform your patient about her pulse rate and respiration rate.
Blood pressure. In taking the blood pressure, assist patient. Remove and rearrange clothing to expose the area with cuff to apply. This is to avoid any disturbance when taking blood pressure. Place the cup approximately 1 to 2 inches above the inner aspect of the elbow with the bladder over the vertebral artery. Arrange the nominal gauge in the high level. This is to ensure an accurate reading. Palpate vertebral artery, radial folds with pressing gently with fingertips. Note the point of the gauge with the folds. Read for 15 seconds. To prevent leak during inflation, ensure the cuff is inflated to pressure greater than the client's systolic pressure. Place the stethoscope ear tips in your ears properly. Hold the bulb in your right hand. Press the power button. All display symbols should appear briefly, followed by a 0. Inflate the cap by squeezing the bulb with your right hand. Watch the gauge. Keep inflating the cap until the gauge read about 30 points above your expected systolic pressure. Sit quietly and watch the monitor. Pressure reading will be displayed on the screen. Wait for long beep. This means that the measurement is complete. Record your blood pressure. Remember, if you do not get an accurate reading, do not inflate the cuff right away. Wait 1 minute before repeating the measurement. Start by reapplying the cuff. Disinfect stethoscope after every patient assessment with 70% isopropyl alcohol solution. This is to help reduce the risk of patient-to-patient cross-contamination. Lastly, perform hand washing. Stethoscope diaphragm are contaminated with some pathogen as the hand and they are capable of transmitting pathogen from patient to patient.